Our goal here at Ngak Min Health is to improve the health and well-being of the children and their communities. Our clientele is mostly, I'd say 85% the Aboriginal and Torres Strait Islander children in the schools. Well, we do serve the community and the parents and the staff of the school also. So our secondary aims here tie into the primary aim, which is to improve the health and well-being of our children. I've always been very passionate in the belief that, especially in a service that, in a health clinic that services primarily Aboriginal and Torres Strait Islander children and teenagers, that we need to have an Aboriginal or Torres Strait Islander presence here in the clinic. And this is where the presence of a Aboriginal or Torres Strait Islander health worker or a health practitioner is invaluable. So the language and cultural differences which some of these children experience affect their healthcare in so many ways, you know, from, like I said, accessing healthcare, so their comfort in accessing a general practice services or walking into this clinic, into Ngak Min Clinic, as opposed to their confidence in kind of revealing to the healthcare provider about their concerns, as well as, you know, them feeling more comfortable in us examining them, adhering to the investigation or the imaging referrals that we undertake, as well as adhering to the medication advice. For example, you know, take this antibiotic 3 times a day, or, you know, I need to see you again in a week, or whatever follow-up process. All of these things are impacted by language and cultural differences. And I think we need to accommodate for that, which is what we're doing here at Ngak Min Clinic, which is different to mainstream general practice. The facts of Aboriginal and Torres Strait Islander ill health or the closing the gap, etc., are well known. By supporting Ngak Min Health, what our partners are doing is basically empowering us to deliver the best quality healthcare and practice in a holistic way that is impossible at the moment in mainstream general practice. Access is hugely underestimated, especially in Aboriginal and Torres Strait Islander populations. So being physically distant from a clinic or healthcare provider often is enough to prevent someone from accessing healthcare. So if you provide, especially in this unique position that we are, which is right next to the school, it removes that physical barrier of needing either transport, you know, a working car, registered car, enough fuel, you know, all those barriers that Aboriginal and Torres Strait Islander families face every day to access healthcare. So this is where we've seen evidence that it has been successful having a clinic located within the vicinity of a school, is because we've noticed an increased number of patients walking through just because we are here. One of the big differences that I hope that we're making here at Ngak Min Health is to give the children enough health literacy and to enough confidence in their own way to manage their health, which they can take them with them for the rest of their lives, you know, and perhaps improve the health so that everything else is also affected positively, which is, you know, education, training, their social lives, their lives with their family, their communities, so they become, you know, more empowered. I think the potential of Ngak Min Clinic is enormous and can't be underestimated. I think we've got these children and these young adults here at a time in their lives when their future lives can be really affected by small things, you know, by small things like treating their iron deficiency, managing their mental health conditions, treating their, you know, their infections, and building relationships and giving them a space where they feel comfortable and respected, and that they know that their confidentiality will be guaranteed. And we've got them at this time, at this precious time, where we can change their life trajectory. So it's not too late, you know, and we've got access because we're right here at the school.